The NHS COVID-19 tracking app has been downloaded over 16 million times, but some employers have told staff to deactivate it while at work. The technology utilises Bluetooth to alert users if close contacts with the app have contracted the virus and informs them to self-isolate. Thousands of employees at pharmaceutical giant GSK, who are actually working on a vaccine for the virus, have been told to switch off the app while on site. The company says strict COVID protective measures at its facilities are different from the everyday situations most of the public will face. A Hull-based fuel firm, Rix Petroleum, have also told their staff not to use the app, again arguing that their safety procedures are adequate and dismissing the app as a blunt tool. Well, banking giants Lloyds and TSB have also asked those employed at their branches to deactivate the app while at work, while the National Police Chiefs Council has confirmed that officers have been told not to download the app, but said the policy is under review and could be overturned. Well, the app was launched in September after a lengthy delay when it emerged during a trial that it didn't work on iPhones. Among its features, a QR code scanner allows users to check in at venues and be alerted if a COVID outbreak occurs on site. But in the fortnight since going public, there's only been one venue alert despite millions of check-ins. The government says the check-in function is just one of several features the app provides.
The NHS COVID app is an important public health tool, downloaded more than 16 million times, which is helping to stop the spread of this virus. Alongside the app's contact tracing features, the QR code check-in system performs a number of important functions, not least providing a digital diary for users to prompt them as to who they have been with, should they test positive.
Well, to discuss the latest app issues, I'm joined by data privacy expert and former government advisor Jamal Ahmed. Jamal, thank you. What's the point of the app if employees can't use it?
Well, I mean, this is the challenge with the app, isn't it? It's the government have rushed to produce the first app they produced was actually rubbish and it didn't work and it was scrapped. And now they've rushed again and produced another app. And the Department of Health actually admit that half of the people that are going to be warned by the app will not be within the danger window, which is within 2 meters for 15 minutes. They also say that 3 out of 10 people put at risk won't actually receive a notification at all. And the 69% of the accuracy of the trials were only successful in detecting the people that had been at risk at 69%, and 55% of people who had not won't even know about it.
Well, shouldn't the government have thought of all this before?
Well, yes, the government should have thought about all of those things before they decided to ask people to download the app. And I mean, we've got Matt Hancock, who is celebrating that they've been coming off the shelf like hotcakes, so 15 million, 16 million downloads now. But the truth of the matter is, unless we get 3/4 of the population, 75% of 67 million people downloading it, the app is unlikely to be effective. And we can see from other countries where they have much better testing in place, where they have much better systems in place, that only up to 40% of the population is downloading it. So it's unlikely to be an effective tool when it comes to combating the fight against coronavirus. And the other concern, of course, is the baroness running the test and trace program, Dido Harding, has a very poor track record when it comes to all things data privacy. So when she was formerly at TalkTalk, she cost the company £60 million from all of the data leaks. We've seen Public Health England using an Excel data sheet with a budget of £12 billion. They're using an Excel spreadsheet which can only have rows of up to 65,000. There's a population here of 67 million people. It's just not good enough.
Jamal, on that point then, saying that also it doesn't cover the population, has the app come simply too late anyway?
Well, there's a number of issues with the app. First of all, it has come too late, but everything the government's introduced has always come too late. And secondly is that it restricts the amount of people that can actually use the app. Because what we see is that for people to be able to download and use the app, they need to have the latest versions of iOS 13.6 on their iPhones, and they need to also have Android 6.0 on their smartphones. Now, the most vulnerable people in our community, the old age pensioners, it's very unlikely, and we know from stats it's very unlikely that they will have access to these smartphones with such high levels of specifications to begin with. So it's not really going to help the people that are most vulnerable and most at risk.
Indeed, and also coming back to the companies as well, what are the main concerns that the companies have? Why is it such an issue for them?
Well, this is the question. It's clear that the companies don't actually trust the app to work correctly, and they're worried that it could actually give a lot of false results. So we can see that only half the people warned will actually be within the danger window. Now, let's say we have people in close proximity in offices and factories and in the police forces, and an alert goes off. It's likely that the whole workforce could be alerted to stay at home, which will bring the economy to a halt. And there's a 50% chance that it could be a false alert, and therefore companies don't have the appetite to take that kind of risk with technology that is unproven. Let's be under no pretenses here. The Bluetooth technology was never developed or never intended to be used for such a purpose, and we still don't know how accurate that might be, and in fact we don't even know how well it actually works. We haven't tried the technology for long enough.
Indeed, lots of things to consider there. Jamal Ahmed, thank you very much indeed.